You're listening to online pet health webinar podcasts with your host, Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealthwebinar.com.
Hey everyone, Dr. Megan Kelly here, and you're listening to the Veterinary Rehabilitation Podcast. Today we have Dr. Margo Roman. She's a vet and she runs the MASH Integrative Veterinary Center, which is just outside Boston in New England, United States. And she's going to be talking to us today about ozone therapy and also microbiome restorative therapy. So I'm really excited to chat to her about the different ways that we can use these treatments in our patients. Welcome, Margo.
Thank you very much. It's really wonderful that you're doing these kinds of projects to bring this information around the world, which is really how easy it is to share ideas and exchange opportunities for people to help their pet patients and themselves.
And thanks for your time. I know you're really, really busy. So yeah, I'm really excited. And there's a few things that I didn't really know about. And the one was that microbiome restorative therapy. I know that you do lots of things in your clinic. So you have an integrative clinic, and I'm really looking forward to discussing how we can use these types of therapies in our rehabilitation cases. But let's start off chatting about ozone therapy. So what exactly is ozone therapy?
Well, medical ozone has been around for a long time. Actually, the ozone generator to make ozonated oils was invented by Tesla, back in the late 1900s. So it's been around for a long time and is an amazing way to bring, which I always thought it just brought more oxygen to the tissue and increased the oxygen utilization of the tissue. But it actually has a lot more biochemical reactions that work at the level of the mitochondria, inducing oxidative stress, which allows the body to sort of it's like kicking it in the ass a little bit and making it do something. And it's amazing when you can wake up mitochondria with oxygen and allow them to run the cells. So the little batteries that run our bodies, the mitochondria, are many of them are so toxic from so many chemicals and things that they don't really react. But when we use the ozone, it seems to just kick them a little bit into gear, and then allows, mitochondria are 10% of our body weight. We have so much mitochondria, and if they're dysfunctional, it's not healthy for us, and we don't metabolize properly. So what ozone does is it increases NAD and increases ATP, and doing this kind of therapy, which is oxygen does that too, but if you can actually medically give this, it's a big changer for all aspects of medicine.
And how exactly do you administer it to the animals?
Well, there's multiple ways of doing it, and because it's something that is fairly new to the veterinary profession, everyone is using their creative minds, pioneering ideas of how to do it. So I first started out doing it just rectally because that's how I was told to start doing it, and then this man Lyle Hassel developed a saline maker that you could give it as a saline, giving saline under the skin. And I started doing that, and that worked great for pain. And I would flood an area that was painful in the back and then do some acupuncture over it. And the pain would go away, and it seemed so much even more potentiated for the acupuncture because I'm bringing more oxygen into the tissue. And, acupuncture works with chi and energy. And so if you can bring oxygen to tissue and then do your acupuncture, then you're getting a better kick for your treatment. And so I kept experimenting with the ozonated saline, and then all these other ways of doing it started to come up with going to courses and classes with human physicians. One was prolozone, which is using prolotherapy, which is a whole nother lecture, but it's using several ingredients like dextrose, B12, procaine, sometimes some homeopathics in there, some B vitamins, and mixing those together to stimulate stem cells. And so you don't have to do surgery on your cruciates, or you don't have to do back surgery. But when you add ozone, it's like flooding the area with oxygen so that when you're stimulating, because ozone does stimulate mitochondria, and mitochondria are highest in stem cells, then the cells that you want to repair the cartilage in the knee or repair the ligament that has been partially torn or maybe lot torn in the cruciate, it seems to repair it, and you don't have to go through surgical procedures to correct a cruciate. So when you have an animal that's in pain, if ozone reduces pain and inflammation, and it stimulates stem cells. So it's a win-win to make something heal. And then there's other ways of doing it. You can do it as orally in water for dentals or for gums or for flushing wounds. You can bag a leg with ozonated gas, as well as with ozonated saline for a wound that you want to get the infection down. Because ozone doesn't discriminate with bacteria, it kills MRSA. So not that I encourage MRSA cases to come into my clinic, but when we find out they are, ozone gets it in like 2 or 3 days, where people have been on antibiotics for weeks and they either want to amputate the leg or they don't think they can control it. It seems to just kick it out right away, which is wonderful. And speaking about, what else ozone does is they actually took it to Sierra Leone 4 years ago when they had the, maybe it's more than 4 years now, 4.5 years ago, when they had the Ebola outbreak, and they treated 4 cases of Ebola successfully with like 2 treatments, and it cost like $7, but the government wouldn't let them do it. So there's so many different opportunities for ozone therapy. One of the other interesting pieces in Brazil, they started bringing ozone in 2011 to the veterinary field. It's been in the human medical field since the late 70s, but the veterinarians started bringing it in 2011. And about a year and a half ago, they had their first Brazilian veterinary ozone meeting, and I happened to be the keynote speaker. But now they have 600 vets that are doing ozone therapy, including rehab vets that are doing it as well. It's wonderful. I mean, if you can do something as simple as giving some cute ozone over a painful back before you put it into the rehab, it would be a win-win for the dog or the cat or whatever you're treating.
So you mentioned obviously you would use it in pain. What other symptoms would you treat with ozone?
Well, I treat all my cancers with ozone. I treat Lyme. I treat any infection. I just had a dog with a high white cell count. I just got the blood work in like 20 minutes ago, and we gave ozone to the dog, and it could barely walk in the building. Its color was pale as can be, and this dog had a mast cell tumor that was told 5.5 years ago that if they didn't do radiation and chemo, they'd have about 6 months. If they did radiation and chemo, they would have max 2 years. Now it's 5.5 years now. But she came in yesterday depressed and couldn't walk, and the owner was very upset because, she's concerned about maybe it's cancer again. And so I said, she could have a bug of some sort, but her color was pale and she was unable to really walk, and gave her ozone and actually another procedure called UVBI, which is a ozone with a photoluminescence. And I used actually a new machine that I have called the Hemolumin. But we did that on her and gave her ozone sub-Q. And she called me this morning. She's like, no, back to normal. And she does have an elevated white cell count, and ozone's great for that because, when we give antibiotics, we don't know what we're treating really. We give we take a culture of one area, but we don't know what is going to respond. So by giving ozone as your treatment, you're stimulating the body to get better. And so it's to me, antibiotics are passé. They're from the 2000s. The next generation is this restorative type of care that we're going to give the body so it can heal itself. And that's what ozone, I think, does.
And what type of equipment would you need?
Well, you need a high quality ozone generator. And you don't want just a very inexpensive ozone generator that uses room air. You use pure surgical oxygen. And there are machines that are made on my website, which is mashvet.com. We have a lot of videos on it, but also linked to some of the companies that we use. But internationally, there are wonderful companies in Europe that are making ozone machines, as well as in Brazil. The ones that I recommend are all local. There's actually there's people that are utilizing it in Australia. Julian Holmes. I don't know. Do you know Julian? Did you know Julian Holmes?
No.
Julian Holmes was a South African dentist who was very involved in ozone therapy and bringing education to the dental community around the world. He passed away sadly last year and was someone who I absolutely adored and learned a lot from him. So ozone is in South Africa, and I think if you try to, look for it and find people that have gotten machines, and what you want to do is get a machine that in South Africa that can be serviced if there's an issue with it, because they don't break very easily. But I'd like to make sure I don't have to ship it all the way back to someplace like, someplace far away, to do it. But
Sure.
there are a lot more companies now making ozone machines, and you just want to, review some of them and make sure they're valid machines, because people can buy ozone machines just to generate water and drink ozonated water. And in dentistry, they do that a lot in rinsing their gums and everything else. But it's used a lot in dentistry all over the world.
Sure. And I mean, are there any risks to using ozone therapy or any contraindications?
Yes, I have a course that I teach, which is an online training course that I have on my website. And I go through the precautions, and they're very few. But it's, to understand what it's doing, and then all these applications takes. The online course that I teach is associated with the American Academy of Ozone Therapy, and I teach with them, and I recorded the course like a year ago, and I'm allowed to put it up there and have it for sale because it's hard for me to travel around and do it. If I could get a large group of people that want to take it, it's worth me flying and teaching the course. But right now, I want to make sure people have access to the classes, and it's but to understand how to do it, it's very, very simple. Any veterinarian can learn how to do it. It's not like studying Chinese medicine for years and learning all the points and learning all the nutritional, herbal combinations. And it's any vet that can give sub-Q fluids, can inject an area, can put a thermometer, in, can put a stethoscope. It's so simple, but it's just understanding when to use it and how to combine it with other supportive ways. Just giving ozone and not nurturing the rest of the body is just a quick fix. I, as an integrative doctor and someone who does functional nutrition and functional medicine, we're always building the animal's immune system, and ozone is a component of that. And just to do ozone and do one thing, I just going off track, but I had a case last week of a dog with pancreatic cancer, a 6-year-old Labrador Retriever, and dog couldn't stand. The dog was vomiting. It was on 2 pain meds, 2 anti-nausea medications, and they had to sort of carry the dog in. She was really not feeling well. And, I have to address not only the gut, which the dog had been on antibiotics for a while, because that was all dysbiotic, but the fact that, the dog couldn't keep anything down and was just, really nauseous. And so we did ozone, we did UVBI, we did ozone over the areas that the dog was painful, over its pelvis. And, and then I told her to get all the pain meds and just stay on the Cerenia for 24 hours and then take that off, and started a bunch of nutritional supplements to help settle the gut and allow the gut to absorb the microbiome that we gave the dog a fecal transplant to, which is the microbiome restorative therapy. So we basically threw all this stuff at this dog who they were thinking they were going to put down because it has pancreatic cancer. And the people came in later on Thursday, and I didn't get a chance to talk to them the day before, with a bag of their stuff. And I said, I thought, well, maybe the dog died or something, because they're bringing stuff back. And so I said, well, were you able to get this? We're not giving the dog any more stuff. I said, well, how is the dog? Oh, she's 85% better. She's running around playing with her toys again. I'm like, wow. But we need to address the cancer. All I did was address the GI tract and the painful back that the dog had. But we have to support the cancer. And I'm in the process now of trying to make these people realize that I can't, just doing ozone and not doing the rest of it is not, for me, satisfying that I'm really helping that animal. I want to try to, do all the things in a natural way, but at the same time address the issue, which is this pancreatic cancer, so that we can try to slow that down.
So you mentioned that microbiome restorative therapy, and am I right in that is basically like a fecal, like a transplantation? Is that right? You
right,
actually
yes.
take
so the term fecal microbiota transplantation is how they've addressed it for many years. And doing a fecal transplant, to me, is just part of my success. So what we did, I changed the word, recoined it, and said it's microbiome restorative therapy. So we're doing a transplant, but we're also doing restorative. We're trying to bring that gut back into a healthy symbiotic balance. So in a normal human being, there are 100 trillion microbes that are in the body, which is more than we actually have cells. From your mouth to your anus are about 500 species and probably 1,000 subspecies. So each time someone goes on antibiotics, what are we doing to that? What are we damaging? We don't even know what we're doing. We're just throwing this at and saying, oh, let's, the microbiome is 75 to 85% of your immune system. And all this research is come out in the past 10 years. In 2000, there was one research article on microbiome. In 2016, this is peer review, 2016, there were 7,123 research articles. And last year, I don't even know what it was. But it is crazy. And the conferences that are going on and the money that's being invested by huge companies to try to figure out if we can capture the correct microbiome, are we going to be able to treat specific diseases? Mass General Hospital has been doing fecal transplants, and they're doing it now for obesity. So if your microbiome is dysbiotic and you have certain bacteria, which we know is more prevalent in heavier people than thin people, if you can switch that microbiome and that's all you have to do, I think people around the world would be thrilled, that I don't have the diet, I can eat like a normal person and lose weight or, be that. So if we can, what we're doing it for, though, is not only GI problems. And my first case, and we're getting off the ozone, but the ozone is an intricate part of this. And I think that is why I see the success that the big hospitals here in the United States who have started doing fecal transplants after I started doing them, and they're not seeing the success that I see because it's a combination with the ozone. So when we do a fecal transplant on these dogs, we're using ozone rectally to do several things. One, it reduces the biofilm. And in the gut, when you have abnormal numbers of specific bacteria that are not the right ones, like particularly like C. diff in people, when that bacteria gets overgrown, then you don't have the ability for the other microbes to regenerate themselves or come into that space, because it's almost like this whole slime layer that's sitting there, and the new bacteria comes in and it goes, we can't stay here. So in people, they'll put them on vancomycin and metronidazole and try to kill everything off. Well, that's not what I'm trying to do. I don't want to kill everything off. I want to give myself a space where I can implant new microbes. So we give rectal ozone first, and we have videos on our website that show how to do it. We want to share this with the world, but give the ozone to blow a hole, not really blow a hole, but we are blowing a hole, but blow a space out where the microbes are killed. And so there's this area that's left there, and then we allow the dog to go outside and defecate, remove whatever was in the colon, and then we make a slurry of my dog's microbiome. So my dogs are the donors. They are 5th generation, over 25 years, fed organic food, have never had pesticides on them for 25 years, and they are very healthy dogs. So we're using their microbiome, which has been tested by Animal Biome, by Texas A&M, to have a high diversity of microbes. And we're giving it both rectally as a slurry and also as capsules. So, and orally, and even giving just oral poop. In the beginning, I was just taking poop and putting it down dogs' mouths before I started doing exploring all these other ways of doing it. But in the beginning, it was literally one-hand job. I grabbed it from my dog's rear end and dropped it in the other dog's mouth. And that was the first ones I did. And I saw amazing, dogs that were dying. Just like this dog with a pancreatic cancer, they thought it was dying. It's running around. A cat with the same thing, with pancreatitis, that was emaciated, that had a feeding tube, was in, hepatic, lipidosis. It was down to, it was at Tufts. They gave up. They had a feeding tube. They were putting Serinium, mirtazapine, and it was throwing everything up with that, you know, even though it was getting nothing orally. Gave it a fecal transplant with ozone first to disrupt the biofilm in the stomach, and and gave it a fecal transplant. And in 2 days, the cat was eating normally and is back to itself. So that is crazy, but we all have to really think about where the microbiome came from. It's been around for about 3,000 million years. And our species is nowhere near that, So the microbiome started before all the species. So they are actually probably, what we're saying is that it is running the body. So these microbes have evolved and have been able to allow species to evolve because of their intelligence. And we have to respect that. And when we go in and we blow them all out with antibiotics, blow them all out with fluoride and chlorine and pesticides and herbicides, and in the United States, we have so much glyphosate in our food. I don't know if you're familiar with Roundup, but it was patented to kill the microbiome now. So it kills the whole microbiome, and our food chain is so tainted with it. And all the dogs are eating that. They're all eating, the genetically modified corn, soy, and wheat that we make. And it's also being done in Brazil and around the world because these big companies can produce huge amounts without just using Roundup in large amounts. So I don't know if that's a whole nother lecture that if you want to get into. But in any case, the microbiome is crucial for the mental and physical health of the animal. And the other thing that we're using it for is for behavior. So I have been using it for behavior for 7 years, taking aggressive dogs, giving them the microbiome for my dogs, and they're happy and they're content.
Wow.
And that part was I just read an article from Oregon State. They took a group of pit bulls that were rescued from a fighting ring or whatever, and half of them were nice and half of them weren't. And the ones that they had different microbiomes. So that is, they haven't done the testing to see if they can reverse it, but we have, and it is truly beautiful.
And you mentioned before when you were chatting, before we started the podcast, that you've seen some good results in older dogs in our geriatrics when you do this microbiome restorative therapy, where you see that have improvements in body strength.
Yeah, so I have one dog who I'll talk about because he's really my hero. And he came to me about 3.5 years ago with liver cancer. He was like 13, almost 14, liver cancer. Unable to walk. He's a big dog. He's part golden and looks like part lab, but could be part shepherd. He's a big guy, and about 90 pounds. And so he couldn't stand up, and he was really having problems. And so I went ahead and did acupuncture and gave him ozone and everything else. And the next day he's like running around. He's feeling good. And so the owners bought an ozone machine. I said, that's the least expensive thing you could do is buy your own machine and do rectal ozone at home and not even come to me because they live 2 hours from me. And so, just do that. So they did that. And then about 3 months later, it was like November, that was August. In November, he had been to the emergency clinic. His tumor ruptured inside of him and he was hemorrhaging everywhere in his belly. And the emergency clinic said he's 14 years old. He can't, he's had cancer for, it's time to put him down. So they called me and I said, I just came back from an international meeting of Frontiers in Ozone Therapy in Santa Barbara, and this veterinarian in Brazil had done intraperitoneal ozone gas for a dog that had cancer, that had cancer within the abdomen, and let me just shut that off 1 second. Anyway, had cancer in its abdomen and in its chest, and so the veterinarians that had referred it, said there's nothing you can do. This dog is full of cancer. It's dying. It's dying. It's dying. So this doctor, Adriana, went and tried IP ozone and put the dog under general anesthesia to do intraperitoneal gas, which I would not tell people to start doing that until they've done some ozone. But in any case, he did intraperitoneal gas under general anesthesia. When he gave the lecture, the dog was still alive, and it was 2 years before. So sure. Baxter came in 2 days after I come back from this conference, and he's in crisis. And they said, well, what do you think we should do? I said, well, I just came back from this meeting and I learned this technique. Would you let me try it? And so when they brought in the lab work, his ALT was 6,000, his SGPT, they were all like 3,000 and 6,000. There's no way I could put this dog under general anesthesia. So I figured out a location in the paralumbar area, because I taught anatomy at Tufts for 8 years and, sort of know my anatomy a little bit. And, I said, I could put a catheter in there with him standing, and let me try that, because I cannot put this dog under anesthesia. Well, it's 3.5 years now. He's still alive. And he's almost 16 and a half. And he still has the cancer. And I've learned a bunch of stuff on him. But one of the things is when he got so weak that after like another episode, like every time he would start to fall down and get weak, I would give him a fecal transplant. And now he stays on fecal capsules, because it's like a youth pill for him. But when I gave him one of the 2 first fecal transplants that I had done on him after this bleed out that he had, the owners called me and said, the last time he humped his bed was when he was 5, and he's humping his bed again. Because I gave him a fecal with my dog's microbiome when she was in heat. And so he was humping the bed. And I was like, oh, yes, that's so wonderful. And we know that precursors for sex hormones, for oxytocin, all come from the microbiome. And if you've got a microbiome that has been damaged, how much of that can you still retain?
Sure, Mark, it's so interesting, everything, and for me, just looking and thinking about our cases, it sounds like sort of the oncology, so those dogs that are suffering from cancer. So we often will be doing rehabilitation on dogs that have had other cancers, and that's also one of our challenges. So they're obviously not feeling well from the cancer, and we're still sort of trying to manage their pain and discomfort from cancers at times, as well as their arthritis that they're suffering on. So I really love the idea of this. And, I don't know any vets in South Africa that are using it.
Well, you start doing it then.
Yeah, Megan, definitely going to look into it.
Obviously we can't really ship you poop cross country or cross oceans, but, to find, there is Animal Biome makes a freeze-dried, it's called animalbiome.com, and they did, and I guess if people requested it, for them to get my dog, they did have my dog's microbiome frozen, and obviously if it became a demand, it's something that we could try to get it there, but that's the only way to get it to you is doing it freeze-dried. Is it as good as the fresh? No, I'm sure it's not as good. Okay. Yeah. Because, fresh is, you've got all the enzymes that haven't been tainted by heat, by the freeze drying process and the timing and the temperature change. And so, ideally what I would tell people around the world is to find the healthiest dogs that you have, the healthiest ones that are on a fresh, non-commercial processed food, but on fresh food, and have been cared for in a holistic way, and utilize their microbiome for your cases. So we're treating parvo with it. We're treating, it's amazing. I mean, just vomiting and diarrhea. A dog with bloody hemorrhagic gastroenteritis that was at Angel Memorial, and they wanted it there for 2 or 3 more days, and it had tarry, stinky, bloody stool, not parvo, just a gastroenteritis. And the owners came to me. We just gave it the fecal transplant. And what I found was so interesting, Ozone too, because I think Ozone is why I'm getting success, okay, with this process. But gave it a fecal transplant, and she said the dog didn't go to the bathroom for a day and a half, had a bowel movement, and none of that tarry stuff was there anymore. That's the part that made me, because when I put the catheter in to put the Ozone in, it was all black and tarry and stinky and really bad. And she said none of that came out. And she said, like at the end, there was like this tiny drop of black stool. Otherwise, somehow all that black tarriness got broken down by the microbiome. I don't know what happened to it, but it all was normal, like a normal stool. So, it's things like that you go, wow, if it's something as simple as shit that you can do, why not try something? But I think it's crucial that you get good donors, because there are other places around the country that are doing it, and they're using their blood donors that are in cages, that are unhappy. my dogs are happy. They hike every day. They live in the woods. They sleep on the couches that I have that are all they don't know. There's no, flame retardants on my couches. It's all organic. They have an opportunity to stay clean. So finding those kind of owners, and they're out there. There are people that are, we're considered, extreme, that we want to eat all organic and we want to eat as clean as possible, and there are people all over the world that do that, and find those to be your donors.
Margo, thank you so much. I've really learned so much, and I'm looking forward to researching more into ozone therapy and microbiome. For those of you that are interested, I will get the link to the online training that Margo has on her MASH website, and I'll put that in the podcast notes for those of you that are wanting to do further training, online training in ozone therapy. Is that on the microbiome too, Margo, or just the ozone?
Yes. So it's 8 hours of CE. And there's an hour and a half on microbiome. There's about an hour on ultraviolet blood therapy. And then the rest of it is on the ozone therapy and what is ozone and how you can use it and different methods and different ways and ideas of using it. But I want more people to experiment using it for things. When I went to just a point for, because it is part of your rehab, but one of the doctor, they had a poster presentation with 3 doctors that had that presented cases of dogs with non-union fractures with plates that wouldn't heal, that had osteomyelitis, and they were going to amputate the leg, and they took the plates out, injected it with just ozone gas right into the center of the lesion. In 2 weeks, all 3 were healed.
Wow!
So this is a major tool that once it gets used in practices, people are going to go say, how did I ever do it? I mean, Julian Holmes from South Africa really brought it to dentistry with several other other dentists, and has treated caries where they inject ozone over the tooth and the carie disappears and the tooth reforms. That's amazing to me. That's amazing.
Unbelievable.
Yeah.
Margo, I could chat to you for hours about this, and I love the passion that you have for this topic. And I just want to just say well done for all the amazing work that you do and all the research that you're doing. And I know that you're lecturing in loads of conferences, and you've got a few coming up, don't you? So for those that are interested.
Yeah, there's a conference in San Francisco that's totally on microbiome. It's I think March 12th and 13th, 2019, and it's on research in microbiome. And then Costa Rica is Ozone Without Borders in Costa Rica, and that's going to be very good. That's going to be the beginning of April. And then there's the SOP Med meeting, which is the Society for Progressive Medicine, and that's in June in San Diego. And then there's another conference in Colorado, the American Academy of Ozone Therapy, and I think that one's in May, AAOT.us. And they've got a lot of really good information on that website as well.
Great. So for those of you that are interested, and if you're in the States, there are a lot of conferences there, and that great international conference in Costa Rica. Margo, thank you so much for your time. It was wonderful to chat to you. I know you're really busy, so I really, really appreciate you taking the time to chat about your passion.
Thank you very much, Megan, and thank you for having outreaching to the rest of the globe. We need to really all communicate and find the best ways that we can care for our animals on this planet and animals, in our homes.
Thanks, Margo. Have a wonderful day.
Okay, take care.
Bye-bye. For more information on continuing education opportunities for veterinary rehabilitation therapists, please go to www.onlinepethealthwebinar.com. Thanks for listening, and don't forget to subscribe to my podcast so you don't miss out. I'm Dr. Megan Kelly on the Veterinary Rehabilitation Podcast. Bye for now.